Well, thank you, Jason and Bill. It's something that many men either have faced or will face, prostate cancer. And a new treatment is emerging that is being called a medical breakthrough because of its minimal invasive approach. Here to talk a little bit about it this afternoon during For the People is Dr. Stephen Gange of the Summit Urology Group in Salt Lake City. Now, this new treatment is called high-intensity focused ultrasound. Doctor, could you tell us a little bit about it?
Yeah, it's interesting as you describe it as new. This therapy was developed in Indianapolis, Indiana, in the 1950s, and has gradually become more clinically utilized. And that really, the clinical applications began in the 1990s. But prostate cancer treatment with HIFU has emerged over the past 10 to 15 years, started actually in locations outside the United States because the FDA had not yet granted approval. And so I first did my training and my initial cases in Mexico. 40 countries besides ours had HIFU clearance, if you will. We didn't really start doing it in the United States until 2015. So from that standpoint, it is new to the United States and to urologists in the United States.
And what makes high-intensity focused ultrasound different than other approaches to treating prostate cancer?
Yeah, so we just abbreviated HIFU. You're saying it all perfectly correctly. What's unique about HIFU is it is truly minimally invasive. There are no incisions. There's no radiation. There's no chemotherapy. It's simply focusing sound waves, and it does this under an anesthetic through a special probe that is placed in the patient's rectum. So if you can imagine, and I think the analogy of a magnifying glass with the sunlight is probably the best one. So the sunlight, of course, is warm. However, if you focus that energy, those waves of energy, through a magnifying glass, which is in essence a transducer, just several inches away, there will be a hot spot. We call it F2. It's a physical property, and it occurs in such a way that we can harness just about any form of energy this way. So this is really sound waves. This is ultrasound therapy, but it's not the same ultrasound that's used diagnostically. That's painless. Someone gets an ultrasound of their gallbladder or something, and we use ultrasound before we do biopsies of the prostate. But once again, harmless transmission of energy. When we use a special probe that has a transducer, kind of like the magnifying lens, we can develop little tiny bullets of energy right at a specific point away from the ultrasound probe. And by marching through the prostate with the aid of a computer program, we can ablate that tissue. Again, it's under an anesthetic, but it's extremely powerful. And when the patient wakes up, because the energy has already been delivered, it's not painful to the patient.
And also, to go along with that, where you're not using any sort of radiation. I remember from my father, who went through this just 5 years ago, for some time, he was kind of at a distance to everyone. And I remember him saying, one of the things that was so difficult for him is he had to stay at a distance from all of his grandchildren.
Right. So you're talking about the seed therapy. And that's true. Those are radioactive seeds. And for about 3 months, radioactivity that could be measured by a Geiger counter is present in the prostate. Whereas with HIFU, once the procedure is over, so is the energy delivery. There's nothing lingering, just the gradual demise of those prostate cancer cells. The other beauty of HIFU is it can be targeted. It doesn't have to treat the whole prostate. And there are times we treat half the prostate or even less than half the prostate. And really, HIFU is unique as a modality that allows for what we call a focal therapy.
We're talking with Dr. Stephen Gange from the Summit Urology Group in Salt Lake City about this high-intensity focused ultrasound, or HIFU as it's abbreviated. I'm curious, Doctor, who are the best candidates for this procedure? Because this is something that affects many men.
Yeah, so, first and foremost, prostate cancer is the number one cancer affecting men. It unfortunately isn't being diagnosed as early as it once was because some information has gone off to the primary care folks that makes them think the testing that we do, the PSA blood test, the finger exam, those things are no longer necessary. It's a long, long topic that we could get into another time. What we know about prostate cancer, though, is if it's detected early, it is curable. Now, the other thing is that not every prostate cancer that's detected is necessarily in need of treatment. So that's a distinction that we make as urologists based on certain findings under the microscope, for example. So in terms of in terms of who's a best candidate for HIFU, we tend to think it's patients who have relatively small prostates because the energy, that F2 length that we talked about, is fixed. Mm-hmm. We can't get into treating an enormous prostate because we can't get the energy to the front side of the prostate in those larger glands. And then we also think that we need to have a prostate cancer that is indeed curable. So the more high grade or the more aggressive cancers, if there's evidence of spread outside the prostate, well, those are not candidates for HIFU. So ideally, we're targeting HIFU in patients who have smaller prostates with curable disease.
So now, as far as the difference where this is so minimally invasive, right. I would imagine the turnaround and recovery is greatly reduced.
Yeah, again, no pain following HIFU. Patients do need to wear a little tube to drain their bladder for about a week or 10 days, and that depends. But overall, that's the nuisance factor. Once that's passed, again, a patient returns to his normal activities. Usually there's no change in sexual function sometimes, but in terms of all of the therapies, this is the least likely to negatively impact sex and also very unlikely to create any problems with urinary control. Surgery can lead to incontinence, and no one wants that. So in terms of its safety profile, it's remarkable, and it's a very efficacious way to treat prostate cancer. We can deal with these early cancers and put them behind these patients.
We're talking with Dr. Stephen Gange from the Summit Urology Group. I know you have a limited time for us this afternoon, but just curious if you could share with us some of the experience that you have seen with patients who have been able to successfully receive the HIFU treatment and be able to then go on, as you mentioned, with very, very little side effects.
Yeah, it's honestly one of the more predictable therapies that I offer for any condition in urology, meaning these patients all get through the procedure, have no pain, recover smoothly. Getting that tube out is the critical, point. And again, it's about a week or 2 weeks, and then return to their normal function. We monitor, like we do for all cancers, the prostate. We monitor the PSA blood test, and we'll check the first one in a few months and then go on from that point. I have seen in the patients that I've treated, I've seen a few patients have recurrences. The cancer comes back. That happens with every therapy, including surgery. This is unique in that we can retreat a patient with HIFU, or a patient can move on to radiation or even surgery. So I haven't seen anyone truly fail their therapy. The guys who had recurrences were well treated with the second HIFU or radiation. And so I think it's, again, the selection of the proper patient is the first, hurdle, if you will. But once we have the right patient lined up for this therapy, the outcomes are very predictable.
So for those who have had this diagnosis recently and are considering their treatment options, how would you best recommend they find out about high-intensity focused ultrasounds?
Certainly there's plenty of information on the internet. I have a web page that has some HIFU information. The actual web address is Urolift, UROLIFT, Dr. Gange, Gange. So uroliftdrgange.com. They can find some information there. They can request an appointment through my web page, or they can call my office, which is 801-993-1800. There aren't a lot of urologists who still, at this point, honestly, I think it's about 50 urologists of the 12,000 of us in the United States who are actively performing HIFU. So I'm the one in this geography. I'm more than happy to see patients in consultation and go from there.
We're talking again with Dr. Stephen Gange from the Summit Urology Group in Salt Lake City. And, many of us are traveling to Salt Lake City on a regular basis for treatments, and this would just be an easy opportunity to be able to find out a way to be able to, as you mentioned, treat this that many of us men are facing in a very minimally invasive option. Again, can you give us your website one more time?
Sure. It's Urolift, UROLIFT, DR Gange, uroliftdrgange.com. And you'll find other information on that webpage. And Urolift is actually a procedure not for prostate cancer, but another area of expertise that I have. So that's a good point of initiation. And then, our usual approach is we do a consultation, which, of course, is covered by insurance. The problem with HIFU historically has been it's an expensive technology, and Medicare had not been paying, commercial insurances had not been paying enough to offset the costs. Recently, in 2021, we're now beginning to see Medicare covering about a quarter of it. There's still some cash out of pocket, and all of that can be addressed in the first consultation. It's just about early therapies, not getting past these insurance carriers, and we see that in every new therapy that comes on the block.
Well, and as you mentioned, it's the most frequent cancer that men are being diagnosed with. I mentioned just before we started this interview, it has impacted a number of people here in our news department, and they've gone through different treatments, and really appreciate your time in giving us information about HIFU, this opportunity that people can have to undergo this minimally invasive treatment and perhaps have it taken care of instead of the seed or the surgery options that are being done so often.
And with fewer side effects. More than anything, it's the side effect profile. We've got a great therapy. We can target it better than we can with the other treatments, and the side effects really, truly are minimal.
Thank you. Again, we've been talking with Dr. Stephen Gange from the Summit Urology Group. Really appreciate your time this afternoon, Doctor.
Thank you, all. Have a good day.